Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. You know, behind all the frenetic pace of activity in healthcare, the complex technology, the state-of-the-art facilities, billions and billions of dollars invested in value-based care, there's a patient that wants answers to questions. They're uncertain, but they've got the power of choice, and they may not understand how to use it to become their own best advocate. Our guest today is Mr. Paul Roscoe, CEO of Docent Health, and he's here to talk about Docent's mission to bring human-to-human interactions back to the patient-centered healthcare experience. Welcome to Health Professional Radio, Paul Roscoe.
Thank you, Neal. Good to be here.
Thanks for joining us today. Docent Health, when and where did you found Docent Health?
The company was founded in late 2015,
Okay.
And we have a goal of helping to help health systems take a much more consumer-centric approach to their healthcare delivery. As you point out in your opening comments, when we think about experience, we think about other industries that have done a great job of redefining and engaging their customers with a great experience alongside the product and service they offer. Mm-hmm. And then when we think about healthcare, we think about great clinical outcomes, but we probably, if we're being truthful ourselves, wouldn't think about it being a great experience alongside that for many journeys. And that's not surprising in many ways, that health systems have been very focused over the last 20, 30 years, improving quality, improving clinical outcomes. But now they are focused on probably one of the most important things that they can do as a health system, which is how do they reimagine the non-clinical experience they offer to a patient when they go through their journey. And they're doing that, frankly, because they're now really in the relationship business. In a world in the past, it might have been a bit more episodic. Patients would come in, we'd do stuff to them, we'd get paid, they'd move out. The notion of a relationship, a continuing relationship, was not really high up on the priority list. But now that's changing. Whether you are a hospital that is looking to continue to grow and you need more volume, or whether you're a hospital that is managing a population and going at risk, both of those require a new capability, which is long-term relationship building. And we at Docent Health believe that one of the ways to do that is by creating a really engaging, memorable experience for the patient alongside a great clinical experience. And that combination, when done in a cost-effective way, creates, we think, loyalty, retention, and maybe even a more advanced form, advocacy. And so at Docent Health, we created a business to take some of the best practices from other industries and bring that into healthcare to allow great experiences to be delivered and great relationships to be built.
How does Docent Health navigate the waters of differing worldviews and expectations based on the age of some of the patients? Many patients, they see the doctor as on a pedestal while they're the lowly patient, and whatever the doctor says goes, and they're not comfortable trying to have a relationship with someone that they think is academically or medically above them. Whereas maybe some younger people, our millennials, our Gen Xers, might have a bit more ease. How does Docent address those issues?
Well, there's a couple of things I'd say to that, Neal. I think you're spot on that it isn't one size fits all. That to create a relationship and to create an experience that is valued by the patient, one first has to realize that you need to deliver a personalized experience. And so the 25-year-old might want a very digitally oriented experience where you're providing content and engagement via mobile or by email or by text or by other digital means. The 75-year-old might want a very human-centric journey. Pick up the phone, come to my bedside, engage with me on a human-to-human basis. So at Docent Health, we help health systems initially provide segmentation of their populations. And that helps really understand, not just from a clinical lens, which is what they really look at today, but from a personal lens and from a business lens, what are the differences between these different patient populations? Once we know that, at Docent Health, we are building technology that then takes the patient down that journey. This particular patient needs these touch points delivered in this different way, some of them digital, some of them human. This patient needs a different set of journey touch points. And so we've codified that in the first place, and then we built that into our technology. So that's one piece. The second piece is that we believe at Docent that this isn't just about creating a rich technology platform. That's pretty important. But we're also, in part of our business model, identified that there's actually a service gap that needs to be addressed. Hospitals historically have hired amazing clinicians, but they haven't necessarily hired for customer service or empathetic orientation or hospitality orientation. So we're helping the health system by adding a new layer here that works alongside their clinical teams, integrates very closely with the clinical teams. This is a function that we call the docents. These docents are people that we employ, and we've trained, and they've come from very customer service oriented backgrounds. And they are embedded inside the hospital or working in a remote location, and they interact with the patient. They guide the patient through their journey using these journey maps that we've built up front. Hence the term docent, to guide, sort of educated guide. And one of the things we found is that patients need a lot of guidance. They need expectation setting. They need to understand what's coming next. They want to know that there's somebody there by their side, not just clinically, but someone by their sides really trying to get to know them as a person, as an individual. We know a lot about the patients as clinical items, but we know very little about them as human beings. What is it what are their preferences? What are their concerns? What are their anxieties? And the docent's role, using the technology platform we built, is to really get to know the individual, help bring that information to the other clinical people that need to know that information, and just generally be there as a patient throughout their journey, not just in a hospital setting, but actually a long way upstream and certainly post-discharge.
How much resistance does Docent encounter when it comes to getting the clinical and the business sides of a facility on the same page, both of which having very different ways of measuring success and satisfaction? Great
question. Let's start with the clinical dimension first. I think one of the obvious questions we get initially from a health system is how does your technology and your people add value, not get in the way? How do they provide additional capabilities that my current clinical teams are not able to deliver? So we go through an exercise of really understanding what the patient wants from a journey. We do a lot of patient research. We bring the patient's voice back to the health system. We do design workshops where we help the hospital really understand the voice of the patient. And I think what we found is that by giving that voice to the hospital, there is a great opportunity for the hospital to really understand what patients want from their journeys. We do the same for the staff members, nurses and physicians, understand what they want from their own journeys. And that's a really helpful exercise for the hospital to really understand this sort of gap that does exist. And many of them have an initial view, well, shouldn't our own people do this? And then they realize when you present the data about what a really patient wants from their journey and the amount of focus that their current clinical staff have on other high-value clinical activities, there is this gap. So that tends to be a very effective process. On the business side, it's very much about ROI. Health systems have a number of critical initiatives, and they need to be convinced that by investing in experience, in these new ways of delivering experience, that is a good business investment for them to make. And so we spend a lot of time with the health system understanding and helping them compute the value of experience from an ROI perspective.
So it seems that getting both the clinical and the business aspects of a facility, a hospital, a clinic, or otherwise, is automatically cost effective as soon as the changes are implemented.
Yeah, well, there's a tail to it. I mean, when we think about ROI, for example, on the business side, there are things that we do that will have immediate benefit. And I'll give you a couple of examples of that. Today, when we think about how satisfaction is measured by a health system, the instruments that are broadly used are pretty blunt. They're not really, in our opinion, telling you a lot about what's really mattering to a patient. There are surveys that hospitals do when a patient's being discharged that are poorly responded to nationally and perhaps a little bit biased in terms of who responds to them. So we help a health system initially instrument ways to really capture the sentiment of their patients, much more across the broader population, not just a small, narrow sample set, and much more real time. We want to know when a patient's unhappy and there's an opportunity to initiate service recovery when they're in their active healthcare journey, not 60 days after they've left the hospital. This is like you getting a survey from Uber 45 days later after you took that ride. How was the ride?
Yeah.
You don't know. You don't remember it. Well, we want to change that. We want to create a much more real-time way of identifying when a patient's sentiment and outlook is dipping and do something about it in the moment. So we help initially on ROI just by increasing the satisfaction of the patients, and whether that's in HCAHPS, these instruments I've just described, or Net Promoter Score. Those are things that we've already started to see from the work that we've been doing with our first set of customers, a very quick, sharp increase in customer satisfaction scores in a very short period of time. The longer term story, I think, is being able to show to a health system that this then equates to loyalty, that patients are not leaking and going to another facility, but they're staying loyal to you when they need additional health care. If you do a great job for that mother, there's pediatric business that follows, and the mother then will advocate in her own family unit for other members of her family to come to that facility. That's truly what we want to track. And that might take a longer time frame, but that's certainly something that we're focused on at Docent Health.
And where can our listeners go online and get more information about Docent Health?
They can go online at www.docenthealth.com. We have a LinkedIn profile, and we have a pretty active Twitter handle as well, which is @Docent Health.
Well, I appreciate your time today.
My pleasure. Thank you for the opportunity to speak with you. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Been in studio with Mr. Paul Roscoe, CEO of Docent Health, talking about Docent's mission to bring human-to-human interaction back to the patient-centered healthcare experience. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download on SoundCloud.